Thank you very much for staying on the program. Now, government is planning to recruit about 177 doctors from Cuba to work at state-run hospitals as the ongoing strike by public doctors here in Ghana takes a toll on healthcare. Health Minister Alex Sebefia announced that the government would also retain Cuban physicians currently in the country whose contracts had expired. He ordered doctors to return to work latest by tomorrow, or today, tomorrow, Thursday, warning a policy of no work, no pay will be applied for those who refused.
Heads of facilities should ensure that their facilities resume the provision of full range of health services by Wednesday, 19th of August 2015. 2. Effective Thursday, 20th of August 2015, all members of GMA who have not reported and assumed full duty shall be considered as being on strike and in clear breach of the Labour Act. 3. Heads of facilities are also requested to monitor and provide weekly updates of which health workers are at post to my office. Instead of leaving them where they are, we intend to start bringing them in to assist in these teaching hospitals. We have on the books at the time, even before the strike, the new batch, which was in the region of, I think, between 177 who are due to actually be coming, but they come in batches. They don't all come at the same time. So you will soon begin to see the arrival of some of these doctors. And I believe that takes care of the issue with the Cuban doctors. They always have come. They've always augmented the numbers of the Ghanaian doctors that work. It's just that in terms of placement now, it's going to be done in a way which will rationalize the particular difficulties we have. Retired doctors are being recruited and are being dealt with on a contractual basis. I'm not in a position to actually give you numbers at the moment, but no doubt before the week is out, I hope we'll be able to give you some detail, not names necessarily, but some numbers as to, even if it's 5, if it's 10, who can be placed, because these doctors will also potentially help with the training of or supervision of the health assistants or the physician assistants, as well as the house officers. So once you have these doctors in, the rest can carry out their functions and they will assist. And we have a number who are willing to take on this task.
A former president of the Ghana Medical Association is criticizing the failure of the National Labour Commission to intervene in the association's impasse with government, which has resulted in a strike by doctors. Dr. Emmanuel Adom-Winfield tells Joy News that the Labour Commission is one of the key institutions that can help resolve the matter. He also criticized government's decision to bring in doctors from Cuba and recruit retired doctors as a contingency measure to deal with the crisis.
GMA problem can be resolved. There is no need to bring in Cuban doctors or recall retired doctors from their rest to come and help. They can solve this problem. And the cost to this country, engaging retired doctors and Cuban doctors, is much higher than sorting out the doctors in this country. We know their deficiencies because, number one, they don't speak English. And I can tell you sometimes their skills and ability to work leaves much to be desired. I've worked with them, I know them. And we are also losing good hands while the strike goes on. People are going out of the country. If they can't make it in Ghana, their services are required all over this continent and beyond this continent. So we are losing very critical caliber of people in this country while the strike goes on. And government is being so adamant in sitting down to talk.
If you say we are losing people, how is that?
People are going out to ply their trade.
Which people?
Doctors are going out.
Is it because of the
frustration? Why not? A Ghanaian doctor is always welcome. Anywhere in the world, anywhere in Africa. They are in hot demand. So if I can't get mine,
so as we speak now, we have some like GMA members.
Members of GMA, they have been going before this problem and they are continuing to go. So it's not going to solve the problem. I would want to appeal to Minister of Health that business of bringing in Cuban doctors, calling in retired workers, and all those stopgap measures isn't going to help solve the problem. I think this posture of macho trying to push people to come to work, or it's not going to help anybody. When we had that meeting last, the rank and file were saying, look, if it means losing our salaries or losing our jobs, we are prepared to do that.
To that extent?
Yes, it's gone that far. Doctors stayed 11 months without any salaries, and yet they continued working. If they have to go on, as far as I understand from what happened last Friday, they are prepared to do that. I think the best thing to do now is for sober minds to prevail. Let the minister and his group sit down. GMA is always ready to sit down. I think they would talk it over and come to an amicable solution. What I'm very sad about is that he, as a minister today, the collapse of the health service will be put on his head.
Put on his head how?
Yes, because it was on his watch. It is on his watch that all this mess is happening. The tenets of the labor law, 3 days after an employee in an essential service has, brought up a complaint, measures must be put in place to resolve it. If that can be done within those 3 days, then there is a 14-day period which all arrangements must be made to resolve it. If it doesn't work, then there should be compulsory arbitration. Why are we sitting here and the Labour Commission has kept silent over this important issue to date? Government has refused to give any channel of communication for people to address their grievances. And the only way they have addressed their grievances is to go on strike. And if we had not gone on strike, if doctors had not gone on strike, government would not have come down to sit with them to talk about their conditions of service. So, if doctors are illegally on strike, government has also been very illegal in not giving the space for people to address their grievances. They have committed the bigger illegality. They should not blame the GMA for what has happened.
Has the NLC come up with anything throughout this period?
Have you heard them? They haven't. They haven't come out with any document, any statement, anything. They are quiet. I don't know why they are quiet. They have awarded costs against government in favor of GMA, but they have not been able to enforce their own rulings. So they even cannot come and talk to GMA as a credible, arbitrator, simply because they cannot function as an arbitrator.
If you say they cannot function
as far as GMA is concerned, nobody has any trust in them. On 2 occasions.
You don't have trust in the NLC?
I do not have trust in the NLC the way it is apparently, composed, because their own laws and their own rulings have been flouted by government, and they have not raised a finger on this issue.